patient safety is at the front of everybody's agenda.
Non-medical prescribers are held to account to a much greater degree for any errors.
We have a consultation with a consultant regularly, so all patients are discussed with the consultant and an agreed care pathway, agreed. So there would be no safety issue.
The familiarity with the patients again, knowing their conditions, and I guess we've got quite a robust system in place from the NMC, which is quite clear on guidance as to what we're allowed and not allowed to do.
We are strongly controlled by medicines management, so that even if we've actually suggested to a GP in the past a medication, they've then contacted us and asked why and to justify our actions.
So we will always work much closer to guidelines, much closer to evidence-based practice. And I think it might improve the evidence-based prescribing. There'll also be pressure on medical colleagues to follow suit. So I think for the patients it's actually a good thing.
How do I think it will impact on the quality of care? I think that patients will feel more valued, because otherwise you can spend 10 minutes or a few minutes listening to them, and then you sort of nip out of the room to go and get a prescription. Whereas actually, if you can be looking at the patient, listening, taking an accurate history, which is all, we have quite a long session on how important the history taking is, then you can actually finish the consultation and sort of wrap it up, and they feel valued.
I think it improves quality of care. As I say, I think it just gives the patient an extra choice of where to seek help from. Like we now have urgent care and A&E, etc., and walk-in centres, it allows our patients to either go to the GP if they're happy to go to the GP, or to come to us.
Being able to work for the patients, as I say, instead of being a third party, relying on a third party to prescribe medicines, the quality will mean that they can actually have any medications that they need at the point of my contact with them. So much quicker service.
So I think if one person has a responsibility for the whole, which often gets quite disjointed in a clinic setting, I can see that improving quality.